Well, happy Thursday, everyone who's been able to join. Second in a series of COVID conversations. We are joined by leadership of the USAID Bureau for Global Health, and we're certainly happy to have them this morning. And I also would like to acknowledge the partners with whom Global Health Council is putting on this virtual town hall. CORE Group and Dr. Lisa Hilme will be addressing us a bit later in the webinar and shortly, as well as the Global Health Technologies Coalition. Jamie Bainishi will be joining us, or has joined us, and will be offering closing remarks. If I can have, my name is Lois Pace. I'll go ahead and introduce myself in case my name isn't on the next slide, but I'm with the Global Health Council, for those who don't know. And again, is a series of conversations that we have designed or organized for the community to really come together around what their challenges, questions, and even solutions or best practices are in light of the current pandemic. We recognize that the conversation needn't solely focus on COVID, but rather broadly on the global health systems and services response or needs in light of COVID-19. And so that's our framing for this conversation. We have at least one more session that we are hosting next week, which you'll hear more about at the closing. But with that, I'd like to go ahead and continue with today's conversation. As people know, I have been trying myself to reflect on the moment that we're in, and I have started a tradition of sharing some words of reflection with the community before we begin these sessions. And this is one I wanted to leave you with today. It's from Dr. Maya Angelou, and it says that hope and fear cannot occupy the same space. Invite one to stay. So I remain hopeful that we will all be able to work towards sort of a better and brighter future, particularly for those affected by COVID-19. I know all of us in global health are working steadily, either on the front lines or behind the scenes, to address all that's happening. And I just want to say again, as always, how much we appreciate everyone here for your work. With that, I'd like to turn the floor to Dr. Lisa Hilme, who again is the Executive Director of CORE Group, who will be presenting to us today some information that she and her group, as well as those of us at GHC in collaboration with Interaction, have learned from you all, from organizations who are working on the ground about how their programs have immediately been affected by the pandemic. Lisa?
Thank you very much, Lois. And good morning to everyone. I hope you're all doing well and that you're safe and sane during these challenging times. Many thanks to Dr. Golden and Dr. Wubenhorst, as well as Global Health Council, GHTC, CORE Group team, and other USAID colleagues, and all of you who are joining today. Next slide. And if you can perhaps mute yourself, then we won't hear an echo. So what I'll be presenting today in a brief 10 minutes is preliminary impact results from our multiple partners. There have been both country and global feedback mechanisms that we've been continuously hearing what the challenges and emerging solutions have been. So these include over 135 organizations that contributed to a multi-consortium, excuse me, I'm a little sick myself, program and operations impact assessment that occurred with US government-funded NGOs, as well as academic private sector stakeholders that are part of all of our consortiums, as well as over 90 organizations that contributed to a rapid needs assessment that was in early March. And we have regular feedback mechanisms and feedback loops on weekly coordination calls, weekly meetings with country teams, as well as CEO engagement and discussions, health practitioner dialogues, and youth consultations, as well as others. Next slide, please. So I've categorize these into several buckets. I want to preface this by saying that this is not an exhaustive list of some of the emerging impacts. And because of the time constraints, we can't actually get into some of the solutions and pivots that organizations have adapted to. So I'd like to frame it in that way. And if there is interest in hearing how organizations have shifted and some of the emerging solutions, we can happily make that available at a later date. So one of the first concerns and impacts of COVID-19 on the international community that's funded by USAID has been the supply chain and procurement. As we know, personal protective equipment, PPE, if you didn't know what it was before, I'm sure you do now. The needs at the country level are a priority concern, not only for nurses, doctors, but also community health workers. Many partners are receiving requests from non-US embassies right in DC requesting NGO assistance with gifts in kind, as well as procurement of items for their countries. But now PPE has been diverted for US needs. So they have had to let their partners know, even when they're opening, they've had long-term projects for, say, opening up a hospital, that they no longer can ship those supplies. So that's been one of the major impacts to come out from the supply and procurement side of things. Reproductive health supplies are also not reaching many facilities and communities. And we have many partners trying to deal with this. Some of the countries are seeing a delay or slowdown also of procurement supplies and delivery, whether it be HIV and TB medicines in Nicaragua, Mozambique, we have malaria medicine that is delayed, as well as Ethiopia, some of the water schemes and infrastructure supplies are not being delivered. And then, of course, the challenges in the supplies of essential medicines and vaccines, which include antivirals and then treatment medicines for malaria, pneumonia, diarrhea. And these are just to name a few. Next slide, please. Next, I'd like to delve a little bit into the health and nutrition services. Many of the USAID funded projects support either health system strengthening, working closely with Ministry of Health, and working with some of the infrastructure. And what we're seeing and hearing from our teams on the ground involved in these projects, that there is a real safety for the clinical staff and an incredible disruption of services, especially with the lack of PPE. I know we are experiencing the same thing in the US, and as a nurse myself, we really can empathize with some of the risk-taking decisions, whether you treat patients without PPE and put yourself at risk. And so, as I mentioned, they've been coming up, some partners, with creative solutions to these, which unfortunately we can't get in today. Hospitals and clinic are also unprepared to treat many of the patients that need to be quarantined. And there's a need for home-based services. And how do you offer this with the travel restriction, the risks that are going on? There is, as I mentioned before, the export regulations of PPE and health supplies that were already earmarked countries but are now being held for US has been a real concern. And so they are looking regionally or at other countries to source those now in order for health services to occur. Lack of transportation services has really restricted population mobility. So how do people get to the actual facility or community community facilities for care. And if they aren't going, or if they're frightened to take their kids, then those health problems are exacerbated. There's also a overall lack of the RMNCAH basic services, and we've learned from a couple of reports that have gone out from partners that the long-term impact of this particularly will be devastating. There have also been emerging gender disparities, not only in care, but also in health workers' protection, amongst others. There's going to be a huge impact on child health. We've heard from our partners that well visits, early childhood development, supplemental feeding, etc. There's been massive delays and disruption. Parents are frightened to take their kids to the facility. And then with school closings, those schools that were providing school meals that are not being distributed or being delayed or distributed less frequently, there is a huge concern about food insecurity. And in some countries, they've actually enabled mobility only to deliver food. And then the refugee health, rural populations, urban settlements, and lack of services. There's really lack of guidance on protocols, how to deal with these populations. Next slide, please. We're hearing also about the community-based services. So many long-term USAID investments working with the communities have now been suspended or shifted to COVID. So for example, mass immunization campaigns because of social distancing have stopped, and there are therefore concerns about polio, measles resurgence. Malaria bed net distribution is halted. There's a need for wash facilities. And we heard a lot about HIV, and there's a lot of impact on the HIV programs, not only testing, but the education and prevention, as well as condom supply. House-to-house visits have been suspended for now in many countries, and with those routine health services. But then some countries have adapted in holding mini workshops with social distancing restrictions if they have PPE. Mental health issues are also rising, not only amongst the population, but about the health workers themselves. And NGOs, governments are trying to respond, but right now it's, the sprint and marathon analogy has been used very much. And then with NGOs, with stop orders, travel restrictions, many projects and services are in limbo. And at the same time, the Ministry of Health is requesting assistance from NGOs. And one of the other impacts is those very important meetings with local leaders, government district officials. They've stopped, and they've been trying other means such as WhatsApp, emails, etc., Zoom, to try to get communities together and have meetings with officials. Next slide. I'm almost at time, so I'm going to just quickly go through these. There's been many economic impacts on programs and communities, not only rising of medical supplies, but we have some of the economic programs from the budgets and the awards, and concerns about long-term impacts from USAID programs. Additionally, many of the project resources have now shifted to COVID. So what will happen when things go back to, in air quotes, normal? There will be no normal. What will happen to those previous project activities? There's been staff that have had to be terminated due to stop orders. And so that really will affect future implementation of current projects and future projects. And another concern is that consultants, small businesses, as well as US contractors, their livelihood is threatened, as well as NGOs and CSOs. Next slide, as I wrap up. We also hear from the research and monitoring and evaluation community about scientists and emerging research that has had to halt. There's a real concern over the students that were in public health or capacity building, that those training programs have been impacted. Some specific examples are here on this slide. And as well, the impact evaluations of programs have been interrupted or canceled altogether. Also, the very important vaccine research and development. Next slide, please. And lastly, we have here just some of the priority needs from the initial rapid needs assessment that went out. And there, I know all of our communities are working very hard to meet these needs with our colleagues at USAID, WHO, UNICEF, et cetera, as well as technical experts around the world. Next slide. And I think that's it. So I thank you very much for enabling us to share some of the preliminary impacts of COVID around the world with US government partners. And I'll turn it over back to Global Health Council. Thank you very much.
Thanks very much, Lisa, and thanks for being on today, despite feeling under the weather. I know we all appreciate it. As we do appreciate all of the rich data that you shared, and I recognize we couldn't quite get into solutions, but we're hoping follow-up conversations definitely cover that. For now, though, I'd like to turn to Dr. Alma Crum-Golden, who has recently been named as the Assistant Administrator for the Bureau of Global Health at USAID. We're certainly happy to have her formally in that role. I think she'd like to respond to some of what she just heard and perhaps just broadly offer her thoughts on, again, how USAID is managing this pandemic and all of its other programs amidst the pandemic. So with that, I'll turn it over to you, Dr. Golden. Thank you again for joining us today.
Thank you so much, Lois, and thank you to Lisa also for that excellent presentation and really such an accurate overview of what all of us, I think, are watching on the world stage, so to speak. I am incredibly grateful to be able to be here today. It is exciting to be welcomed in such a wonderful venue as the one you presented, Lois. I appreciate it. I also want to express my support to so many of you who really were kind of willing to stand beside me through the nomination process and offer encouragement and insights as well as that process unfolded. I'm indeed honored to be part of Global Health. It's a really amazing time to be here, and obviously I'm humbled by both the scale of what we do in global health on a routine basis, and especially with the challenges that all of us are confronting with the COVID-19 pandemic. I'm going to make a few simple remarks, and then because Dr. Rubenhorst actually has a call she absolutely has to be on in 9 minutes, I'm going to let her make a few comments, and then I'll come back and finish my observations and comments. Basically, I just want to let everyone know that as I began my service in global health, it was clear to me that we really do have a really challenging opportunity in front of us, and I wanted to be able to sort of simplify how we were responding. So I think we really brought it down to 3 things that I believe all of you are probably doing for your own organizations as well. That is that the first priority has to be to protect our staff, our people, because if we don't protect the incredible experts that we have that are serving in global health, then we lose our capacity to be effective around the world. So first, we're protecting our people. Second, we're making a very serious effort to protect all of our programs so that we have a strong maintenance of operations. And third, we're responding aggressively to the pandemic. So what are the actions that we've taken in order to accomplish these things? First of all, we have at USAID tried to implement a good leave policy and flexibility regarding telework so that our folks who are working at home and often have other challenges, whether it's dependent children or elderly parents that they're caring for, really will have the capacity to address those many obligations. Secondly, we're trying to be encouraging for folks to use staff care and other support systems. We want them to stay connected and comfortable with their own personal lives as well as their work lives. And we're also trying to collaborate really aggressively with our contractors because, as you know, many of the global health staff are actually on contract as well as government employees. Second thing we've done on protecting programs, we've divided off global health into two main sections right now. One is the maintenance of operations. That is managed by Elaine Cook and Carrie Pelsman. They're doing an amazing job. They're looking at streamlining our processes, our meetings, and other things around that line to be sure that we're able to address the challenges of not only the current programs, but the extra pressures they're facing in a secondary way, as Lisa described very well, in terms of the additional challenges from malaria, HIV, maternal child health, family planning. All of those face additional challenges. And then we're doing, in terms of addressing the pandemic, I'm going to turn to Dr. Wubenhorst right quick because she's actually taking charge of our response on that. So Monique, would you offer some comments, please? Over.
Yes, thanks very much. And again, I want to express appreciation for the warm welcome and the really excellent comments sort of summarizing the situation by Lisa. Yes, that picture definitely looks better than the video I'm streaming right now. So I did want to just take a couple of minutes to discuss our response. As Dr. Golden has indicated, we are very grateful for the opportunity to discuss this, what we're doing in this fast-moving pandemic. And so I want to just share a few thoughts with you before I do apologize. I've got to, excuse me, I've got to get to another call, of course. So how is global health responding to the COVID-19 pandemic? Well, in a nutshell, we are following the direction given by Dr. Golden, which is that we have to preserve our staff, preserve and support our staff, and we have to have an adequate response to the pandemic, followed by a recovery phase as well as a resilience phase. And we also need to effectively coordinate with a wide variety of stakeholders as well as the interagency and coordination even within our agency. So at Dr. Golden's behest, we have stood up the Global Health Sustained Crisis Response Team, effectively referred to as the SCRIT, which has as its goals and mission to provide technical assistance and financial support to mission staff and staff in the agency who are dealing with the COVID-19 pandemic. The objective is to use innovative approaches to build the in-country capacity of partner organizations to efficiently and effectively limit the impacts and contain the spread of the COVID-19 virus. And our intent as a bureau, as a Global Health Bureau, is to provide support to partner countries to protect and save lives from COVID-19. And so in order to stand up the SCRT, we examined several potential alternatives, and the one which we eventually settled on was to establish something called an Incident Action Plan Framework. What the Incident Action Plan Framework does is to establish a paradoxically hierarchical organization that empowers its members to act independently and quickly. And this is the same type of framework that's used in responding to natural and man-made disasters. It was used very effectively, for example, in the Exxon Valdez oil spill, and is used in wildfires. And so there's a fairly well-developed literature and body of information around how these teams work. The reason that we chose this team is that we recognize that in one way or another, some of our USAID Global Health team members have been responding to pandemic threats since 2014 Ebola, and that was followed by Zika, then by Ebola 2018-2019 in DRC, and now COVID-19, and of course we are seeing resurgence of Ebola. And so to protect our staff and to help them to not become burned out with all that entails, we decided to employ this particular framework. What this does is that it creates procedures, timelines, and communication strategies to complete specific tasks and identifies critical information. As you can imagine, in the medical literature alone, there are approximately 1,000 papers being published every week. And so there's a real risk of information overload and missing the signal that's buried in a lot of noise. We want to streamline the delivery of information to inform leaders in the response, and of course to support our bureaus in leadership, as well as the COVID-19 task force missions and implementing partners as part of our unified effort. I'll very briefly go into the structure of the Sustained Crisis Response Team. It's under the direction of Dr. Golden and then myself. The SCRT has a Secretariat Liaison function, as well as communications, Deputy Incident Commander, Strategic Planning, Incident Commander, Deputy Incident Commander, Strategic Planning and Operations, Management Support, Programming and Supply Chain, Technical and Analytical Team, and a Coordination Team. In addition, we have a Senior Advisor, and that's Richard Green, who's well known to many of you as well. So the different teams have different responsibilities. Again, I'm going to just go through this very, very briefly. With communications obviously being one of the most important components of the team, again, because of the multiple internal and external stakeholders, as well as press releases, engagement on the Hill, and so on and so forth. Strategic planning and operations has to do with coordinating and mobilizing planning and funding activities, in particular those with existing and new partners. The management and support team does exactly that. One of the salient features of this particular incident command structure is rotations. This is how we keep staff from burning out and breaking down. Every 28 days, staff rotate off. Staff are required to have a full-time commitment for 3 weeks, followed by a 1-week overlap with the oncoming team member or team leader, at which point they rotate back to their original job. So this will allow people to stay engaged with their regular responsibilities, as well as to get refreshed when they're not in the midst of this extremely fast-paced and dynamic environment. The technical and analytics team has actually been extremely active and has done some outstanding development of guidelines and assessments, as well as assessing technology. And they have also provided technical advice on procurements and programs, especially related to vulnerable populations, social and behavioral change, diagnostics, health systems, and so on. And finally, the coordination team and the coordination team really helps to ensure that all of these rapidly moving parts mesh together to enable us to have a coordinated function. So again, I apologize and regret having to leave the call early. If there are specific questions, I'm sure that it would be fairly straightforward for those questions to be funneled to us. We look forward to working with you. We look forward to really serving our beneficiaries, who are really the people whom we care most about and whom we want to help in the midst of this challenge. Thank you very much.
Thank you, Dr. Rubenhurst, for joining us today. We appreciate your time and recognize you all have very busy schedules. So good luck with the rest of your day and week. And thank you again for providing some additional remarks to follow on what Dr. Golden shared. If I can have the next slide, I believe it describes how we're hoping to approach our Q&A session. So what I will do is ask a few initial questions to the USAID staff who remain. I'd like to acknowledge that we're joined by additional leadership at USAID, including Elaine Koch, who's the Deputy Assistant Administrator there, Senior Deputy Assistant Administrator there, and perhaps others that can acknowledge or introduce themselves as they respond. But first and foremost, as Lisa said, we've heard a lot about PPE, and I think people are concerned about guidance for PPE, specifically how they should be distributing or procuring those, everything from whether partners can use existing U.S. government funds to procure PPEs, again, and what supply they expect that to be available in lower middle resource settings, given shortages even in the U.S. And also just sort of, unfortunately, who comes first. So, you know, the priority or other guidance that should be considered when distributing PPEs, not just to those addressing the COVID outbreak in countries, but also to those who are delivering care across other programs like TB, HIV, and the like. So I don't know who wants to take that question first. I can present it first to Dr. Alma Golden, considering she's still on the line, and then see if she'd like to pass it around. Thank you.
Thank you, Lois. Yes, I think all of us have shared the same concern. Certainly, this has been a very unique and I will say frustrating pandemic, because it has made us aware of where a lot of the gaps are really globally in terms of how well we can provide for something that demands a great deal of material, supplies, and medications at the same time that we have disruptions in supply chains. So we are following the guidance that we get from State Department and other entities very closely. We have been looking particularly closely at how we can, even on the things we're not able to move yet at this time, we are positioning ourselves to be able to maximize our responsiveness as soon as that flexibility is available. In the meanwhile, I think we've seen a lot of creativity, a lot of thoughtfulness in terms of how all of our partners, as well as our missions, address potential. It's been heartening to see the increased manufacturing that has sort of happened spontaneously for hand sanitizer, face masks, reusable gowns, and all of that, that I know all of you have seen that as well. Just know that we are positioned as soon as we have clear guidance that we can be flexible and move more materials. We certainly want to do that. Thank you. Over.
Great, and I know we're also joined by Carrie Peltzman from the Global Health Bureau as well, who's DAA there, and I wanted to acknowledge her on the call. I don't know if Carrie or Rain wants to respond to that. I do have a number of questions though, so you will have an opportunity, of course, to weigh in. So another question that people have somewhat relatedly is around goodness, where do I begin? I think it's around workforce largely, right? And so in addition to just being concerned about the supply chain and stoppages or stockouts there, I think people have expressed some concerns around staff departures, mission closures, or reduced staff at the mission level. We recognize the importance of protecting USAID teams on the ground, and yet we also are aware that that might sort of limit engagement with country partners, whether those partners be at the government or community level. So can you speak to what you all are doing to mitigate that, whether it's around remote engagements or perhaps leveraging other existing networks or initiatives that work remotely on that sort of best practice exchange?
Lois, this is Alma. I'm sorry, I had a phone call coming in on my phone at the same time, and I missed the very beginning of that question. So this is in relationship to the pause on WHO funding. Is that correct?
No, but you were more than welcome to respond to that. it's
Sorry.
Actually, no, it's totally fine.
I first of all want to apologize that I didn't figure out how to do the audio on the webcam, and I had to call in on that. So that's part of my own technical challenges. So
I think yes, we're all facing a number of challenges. Technical, the least of them, probably. So I was just asking about mission staff, and in particular, and the fact that you all are trying to protect your teams on the ground, certainly, and yet they're those relationships between USAID missions and country partners, community partners, government partners have been essential to the fluidity of programs. And so just wondering what you guys are doing to mitigate any negative impacts from staff being pulled back or called home. So are you sort of utilizing remote I guess initiatives or technology, or are you working through liaisons, other initiatives or programs to build those bridges? What's happening to account for the kind of the shifts in on the ground staffing?
Thank you. And I think, Elaine, are you going to answer that? Because you're doing some very good things. Thank you.
Yeah, no, thanks, Alma, and thank you, Lois, and thanks to all for inviting us here to talk with you. We really are grateful, and I know it's long in coming and long overdue. So thank you very much for the time. Let me start answering that question because and I'm going to ask Carrie to jump in as well because she's been tracking this really carefully. And exactly as you described, Lois, it's something that we're very concerned with. We have been having regular, very like twice weekly calls with our field staff. A number have been are on what we call authorized departure and are here in the US, but working remotely from here in the US. But that's, I said, there's still an awful lot on the ground, including all of our Foreign Service national staff. So a lot of what the agency is doing everything we can to support that Foreign Service national staff and in trying to keep track of who's on the ground and who's there. Essentially, all of our missions are still operating. They're still there. They may be completely overtaken by COVID because as their Ministry of Health and counterparts are completely overtaken by COVID, but they are on the ground. Carrie, do you want to add on and add a bit more detail there? Apparently she is.
Okay, great. Now I think people can hear me. Yes? Great. Hi. Let me reiterate Alma, Monique, and Elaine's thanks to the Global Health Council for the opportunity to join you. We actually have a smaller percentage of the USAID health officers, the Foreign Service officers, who've taken authorized departure, but those who have come back to the US are still working remotely and joining their mission health teams, primarily virtually, and many of them are actually working on the hours of their mission. So they're, starting their work days at 4 p.m. and working through until midnight or later. So many have shifted their schedules to be able to maintain their contact with the teams. The Bureau is trying to support the teams and providing twice a week calls to the field. The agency overall, as Elaine touched upon, is doing a lot to try to maintain continuity of operations in the missions and tracking the status. It was very interesting to hear the presentation about the IPs, the partners' experiences in the field, and there was a reference to creative solutions, and we'd be eager to hear more about that. And I'd love for people to just reach out to me by email, because the more we can share that and ensure the health teams and the health officers are aware of approaches that people are applying that could be replicated elsewhere, the more we can help to respond to the situation in the field. That said, I know there's also requests to implementing partners as well as to USAID health staff to engage with and maintain ongoing coordination with Ministry of Health officials, with the development partners in country, and a lot of that is still ongoing to my knowledge and understanding. So I hope that's helpful. Over.
That is helpful, Carrie, thank you. And I think as a follow-up question, one of the concerns we've also heard among this group is the challenges to retaining staff. And so just, I think people are curious to hear if there's guidance or recommendation around furloughs and other options for them. I think we certainly want to be retaining program talent across US funded work on the ground, and wasn't sure if you all had a comment in that regard.
This is Elaine. Let me chime in on that. I mean, it is obviously a concern. and it would be, and this is where and Lisa, thank you for some of that in the data you shared at the beginning of the call, but we'd really be interested in hearing from you where you're encountering the partners have had to, programs are stopping, or there is no more funding and staff are being furloughed. I mean, the bottom line is there is still funding, all of our regular funding is still moving, and there's even more work to be done because of COVID. So certainly within USAID, no furloughs. I do know that some missions have had to make some adjustments to their programs, and I think that might be some of the reverberations implementing partners are encountering. But it'd be helpful to hear a little bit more on that, and examples can certainly be shared offline. The other thing I would say is that we have been in constant contact with the head of the Office of Acquisitions and Assistance and all of his staff, and our ongoing way just to make sure that whatever adjustments are being made for implementing partners are being addressed. And I know our acquisitions and assistance and contracting officer, et cetera, colleagues are having frequent discussions with the broader community as well to try to address some of those. Over.
Okay, great. Thanks to you both for moving through these. We really do appreciate it. Iraine, since you brought up funding briefly, let's get into that because there are a couple of questions in this regard. I mean, I think there's just one generally about how you all are tracking emergency funds, really having an understanding of who's receiving new dollars from which sources and when that happens, when people will be able to apply if they haven't already, and how that funding is going to flow. And then there's a question about whether or not there's restrictions on that funding, for example, as it relates to the existing PLGHA policy. So could you all speak to funding in that regard? Thank you.
Yeah, I'm actually going to turn to Monique had to get off, but I don't know if Alma, you want to touch on that, or Ricardo Eschalar is also on the phone. Ricardo is part of the sustained response team. He's the deputy within the sustained response team and can perhaps talk a little bit about the process. In brief, a lot of money has already gone out the door. Currently, it's largely through some of our existing platforms, but I think there will be opportunities in the future. Ricardo, do you want to jump in on that? Or Alma, I don't know if you want to say anything more as well.
This is Alma. No, I think that I think it's been a really good question because we've had the challenge of really trying to understand multiple things at the same time, and that actually was referred to on your first presentation that Lisa gave. The targets are a little bit difficult to identify in terms of how best to spend our money, and do it quickly in a way that genuinely makes a difference. So as a general rule, we've been looking at high leverage activities that we believe that we should be funding, and that obviously has implications on who we should be working with. As everyone knows, one of the biggest predictors of the impact of the virus tends to actually pivot around individual, family, and community behaviors. Consequently, we've really had a focus already in terms of trying to have good risk communications out there, some good just social behavior change approaches, being able to try to get information out to trusted community leaders, faith-based and education leaders, that sort of thing. And clearly, we're also very concerned about WASH, especially WASH in health facilities, as Lisa mentioned earlier. And also then we do have the issues of the health provider training, supply chain issues, that kind of thing that we're really focusing on. Those are some of the activities that have really captured a lot of our early interest, along with the fact that we recognize data needs and testing needs. But that doesn't always give us a good eyeball or viewpoint in terms of where the help is needed the most. So we really have had some fairly intense conversations with the other parts of our agency. We're working closely with the task force that is managed by Dr. Ken Staley. We're also working very closely with DACHA and Admiral Ziemer's group there. We are literally in contact with the different parts of the agency many times a day. And we also are working closely with state to listen to what their perspectives are and the impact the input that they're getting, along with CDC, NIH, and other parts of HHS. Basically, we take all of this input in on geographic distributions, and we also have a quantitative tool that we've developed to kind of look at what countries are highly vulnerable based on their poverty rates, the fragility of their government, the health system strengthening activities, and just a number of issues around the other disease burdens that they may have. All of these factors are part of our decision-making process in terms of how we distribute the funds. We have had 3 tranches of funding so far, each approximately $100 million. And the last tranche, I think we finalized getting most everything out. If I know correctly, it was about yesterday that we should have been finalizing that, or we may still have a little bit to do today. But I think we really are trying at this point in time to get the long-term view on this. We must respond very quickly and effectively and in collaboration with all of you right now to address the emergency. But all of us, everyone that I've talked to recognizes that then we're going to have a recovery phase, and then we hope to have a resiliency building phase. I think all of us recognize that this could be an episode that causes a collapse of our systems, or if we do this well together, perhaps it's actually an opportunity to leapfrog by identifying the gaps that we have in health systems and effectively identifying some innovations and systems that would really help in the future. So with that, I'm going to let Ricardo talk a little bit about how we're actually delivering these services and identifying these needs. Ricardo?
Hi, good morning, everyone. Thank you. I think Alma provided an excellent overview of how we're doing things today. And as Irene mentioned, what we've been trying to do is also incorporate best practices given our recent experiences with Ebola in West Africa, with the Zika epidemic, and also the ongoing Ebola epidemic in Eastern DRC. We rely heavily on the input from our missions and field staff to help identify those gaps and needs. One thing I did want to add, I'm sure many are interested in this as well, is that the agency has a landing page for coronavirus. Many of you probably have seen this already, but on this landing page, there's also information there regarding unsolicited proposals. So we encourage you to look at that page and submit information directly to that landing page and the email address that's on that page for future opportunities. We are working through our existing structures in many cases, but we are also looking for those opportunities to address the country-specific needs that are becoming more evident as a result of this pandemic, and recognizing every country and every location has different needs and different impacts and at various times. Obviously, we are working across the Bureau to address these needs and leveraging existing investments across our PEPFAR portfolios, PMI, Global Health Security Agenda, and regular programming, and seeing what can be used and applied to meet these needs in each country. And we are following the same structures as we've done in the past for our responses, and requiring to work with our mission staff to address those needs and to be able to report back as we need to meet those conditions as set forth under the supplemental funding that has been provided to us by Congress. I think that's it for now. Thank you.
Thanks very much, Ricardo. A couple of follow-up questions, perhaps for you. So you and Alma both spoke to priority countries, and I know there are some people wondering whether given the nature of the pandemic, whether you all are still going to work in your current priority country framework, or if you're saying you're open to countries that are considered priority as a result of COVID, even if they haven't historically or at least recently been in USAID's portfolio.
Sure, I
This
can.
is,
Oh,
yeah, I'll let Ricardo take it. You go ahead,
Yeah.
Ricardo.
I'll briefly answer, but then pass it over to Alma. Recognizing that this is a global emergency, it's important for the U.S. government and USAID to provide that leadership and that response to countries that need that assistance. So as Alma mentioned, we're working across the agency with the task force and other parts of the agency, including the Bureau for Humanitarian Assistance with our counterparts in OFDA and Food for Peace to address those needs as and the requests that countries are submitting to our embassies and missions abroad. So yes, we are the priority countries. We are, a lot of it at the beginning was looking at that immediate geographic focus, looking at the immediate spread within the region. But then that has taken on to a much larger approach, recognizing the vulnerable health systems in many countries, even in countries where there is not USAID presence. So this is all part of a collective effort, working with State Department, CDC, and others to identify what are those needs and to identify how we can ultimately make the world safer from these infectious disease threats and also protect the United States. Alma?
So in short, we are receiving requests from many, many countries, and we are indeed looking at putting funding out already in the past and in the future for unique countries and environments where we have not worked before. The last tranche went out to 60 countries, and several of those are not where we've had presence or current programs, but we are looking to be collaborative with those countries and look at how we can assist them during this time. Thank you. Over.
That's very helpful, and you all are graciously answering not just these questions, but others that follow. So thanks for staying ahead of us in that regard. So I think we have time for one more question at least. We have talked about you all's priorities from response to recovery to resilience. We talked a bit about sort of services on the front line and implementation issues, as well as funding. And everything in between in terms of operations and delivery of these services and programs. But one thing we haven't touched on yet is innovation, and we recognize that USAID has a lot to offer in that regard. I mean, in the case of other infectious diseases, other outbreaks such as Ebola and Zika, there is a support of USAID's efforts to stand up grand challenges promoting open innovation to quickly develop and adapt technologies and really support populations in low resource settings. And given that's coming up again with COVID-19, particularly because of the great demand for those technologies around the world, we're just wondering whether the Bureau is leveraging its technology and innovation expertise for point of care diagnostics, PPE, and other technologies.
Lois, I thank you so much for asking that. As you know, I just spent a year in the Global Development Lab and had the pleasure of kind of getting to do innovation for a full year with them. And that is clearly important to me now, and it's very, very relevant to our activities. We do have very active engagement in both the global health front and in the development lab front as well. There are a number of venues through which groups can submit suggestions. As we've already mentioned, there's an unsolicited proposal framework that can be reviewed through our SCRT, and we also are looking at doing, as you indicated, a Grand Challenges platform, and we are looking for collaborators on that. Other folks that would be a part of that Grand Challenge perhaps donate to it. We believe that if we can get a fairly significant combined amount of funds, that we could really quickly leverage some of the interesting ideas that are just emerging so rapidly out of this. I think it's fascinating to see how many people are thinking creatively about how to respond to this particular situation with the pandemic. So those are both the unsolicited proposals and our CII, our Center for Innovation and Impact, are looking actively on innovations there. I will mention that under Ricardo, he has a technical advisory team that's looking very closely at that. Now, you may have him speak to that briefly after I mention the lab resources. As you know, we also have the Development Innovation Venture inside of the Global Development Lab. And there are also platforms like the Global Innovation Fund, which has an open forum as well to accept ideas that are made available then to venture capitalists that can look on and identify whether there are things that they see they'd like to fund. So there are many different opportunities, and I'm going to turn it back over to Ricardo to talk a little bit about the technology group and the reviews they're doing. Over.
Thank you, Alma. Yes, we have an excellent group for the technical and analytics group, and they're also building on the efforts that the task force is doing in these endeavors, trying to capture as much of the evidence as we have now, recognizing that things are constantly changing and we're learning more and more every day. But they are such an important part of this process to be able to review and identify what are the best practices and applying those situational contexts for our interventions moving forward, and seeing what innovative processes, but also ways that we can adapt to the situation on the ground in each of our interventions across multiple cross-cutting areas, but also providing support to the Bureau overall. So it's an excellent group. We are very happy to have them, and they bring expertise from across the Bureau and different disciplines. And that's really a testament to the strength we have within the Bureau, but they're also pulling from across our implementing partners and other partners that we have in the Bureau. Over.
Great. Well, thanks very much to all of the USAID staff and leaders who joined us today for a pretty robust line of questioning. I think we could do this again, and very much appreciate you all accommodating us, and hopefully you're amenable to doing part two. There's some additional questions I know people have that that I've sent along to some of you, perhaps for follow-up after the call. But for those who are on the line, apologies, we couldn't get to each of your questions, but hopefully you have a better understanding of things following that session. Not to steal Jamie's thunder, I think I will go ahead and transition to her to close us out today, but again, extend my thanks to each of the speakers and participants. Jamie?
Perfect, thanks. Yeah, I think my reflection is that we probably could spend an hour on each of the questions Lois asked today. But Dr. Hilmy, thank you for giving us your report from the field and looking at those preliminary impact results to frame our conversation today. Dr. Golden, really helpful to understand your focus on protecting staff, programs, maintenance of operations, and responding aggressively to the pandemic. And I think for those of us who work so closely with USAID, it's really helpful to understand the leadership role and sort of your divide and conquer leadership structure as we engage with your colleagues and with your staff to tackle COVID. Dr. Wubenhorst, also, I think it was really helpful, even though I think she's off the line, just to understand the framework around response, recovery, and resilience, and learning more about the SCRT, if I got the acronym right. And Irene, Carrie, Ricardo, and Alma, again, thanks for helping to answer all of these questions. I think just to summarize briefly, I realize we're at the top of the hour. I've just noted a few immediate sort of next steps for the global health community to consider, and some places where you've said that you could use some additional feedback from us from the community. So Carrie, I think we will be eager to follow up with you about creative solutions, and I promise we will follow up on that. Iran, you also had asked for input on examples of furloughs or some of the staffing challenges, so I think we will take you up there as well. Ricardo, really helpful for those who weren't aware of it to understand about the COVID, the landing page that you've developed and looking at future opportunities as well as unsolicited proposals. So I have a feeling a lot of partners will be reaching out in that regard. And then, of course, near and dear to my heart is looking at how we can adapt innovation. So Alma, great to see that there's the focus on looking for collaborators to open innovation and looking at a challenge model, perhaps including diagnostics and PPE, and then thinking also about innovative funding structures like the DIV or the Global Innovation Fund and venture capital opportunities to bring in a broader group of stakeholders to look at innovations and specifically thinking about the low resource settings that we all serve. So again, I think we could have used a lot more time. I know there were a ton more questions, and I do hope this will continue to be an ongoing dialogue and that we can do a deeper dive on some of these issues moving forward. Just quickly, I will also note that as part of the Global Health Council's ongoing digital dialogue series, wanted to flag that on Tuesday, April 28th at noon Eastern Time, GHC and Kaiser Family Foundation will present a webinar discussion on the challenges and opportunities for resource mobilization in response to COVID in LMICs. And I know that speakers will be sharing their updates on how COVID-19 is impacting global health programs, following up on some of what was mentioned very briefly today, thinking about solutions emerging to tackle some of those safety concerns and the disruption of services, and of course, reviewing recent data of COVID-19 funding trends. So with that, I will stop. Thank everyone, all of the speakers for their time, and thanks everybody for dialing in today. Take care.